Kelly Shanahan. I'm a physician with metastatic breast cancer. I am Vice President and Medical Director of MetUp. I have a question about the studies, specifically with Palbo and everolimus, showing really pretty good results in progression-free survival, but really not keeping us alive any longer with overall survival, or no data on the overall survival. Is there any way, as patients and patient advocates, because you did mention the patients get out of the trials last for a couple of years, patients get out of the trial, they eventually progress, they may go on something else. Is there any way as patient or patient advocates that we can help collect data or facilitate collection of data on what do these patients do next? Is there a difference between a patient who does well on Palbo in terms of what they may do with their next line of treatment? And again, as advocates, what can we do to help you do the research to keep me from dying in the next 3 years?
Well, I can start off with that one since I talked about hormonal therapy, but the trials with hormonal therapy weren't designed with the number of patients and the statistical power to detect a survival advantage. But nevertheless, when you do look at the death rate, which in the first few years is usually not that high because people are doing well, but even as time goes on, as far as we have been able to look with both the everolimus and the palbociclib study and some of the later ones, I suspect will be the same. We're not seeing a difference in the death rate at the point in time that we're looking. But many of these people are living longer and going on to other therapies. These trials are designed to pick up what the next therapy is, but they don't follow patients on all the details for patients. They do follow their survival over time. So the trials will be updated and will tell us if anything changes. But you're right, we fundamentally need to understand cancer at a different level to start making an impact on survival. And actually, a lot of the clues that we get from patients' tissue, or even from just how patients are doing, are very important. There are a couple of efforts underway to develop what's called a registry trial, where we simply gather data on patients throughout. There are multiple therapies that they're going to get. So these are 10-year studies that follow patients for much longer than they do on the trials, and we're hoping that that will give us some clues. All of the more recent trials, the palbociclib trials and the ribociclib trials, have collected tissue and are now collecting blood, because we can do so much more from the blood in terms of looking at genomics and evolutionary changes in the genes. So there actually is an effort to get tissue over time to try and learn more clues about what's going on. In fact, some of that was presented earlier today. What are the evolutionary changes that occur in patients as they go from sensitive to resistance? How can we learn from that? So I do think that, so all of those things are going on, and I think they will help us. And this has been in part because of patient advocates insisting at a community level, at an advocacy level, along with physicians and researchers, that we have to collect tissue. And the federal government has stepped up to the plate to fund some of that. And drug companies have started to. They used to not be interested in that, and they are now doing tissue correlative studies. So we are at least moving in the right direction. Other things that I think patients can do to answer your question, be informed, be vocal like you're doing, keep records of what treatments you're getting. Because I envision a future where social media is going to be a much bigger part of research, and researchers are actually going to be using patients and their knowledge and pool the information together more and more as time goes on. I really see that that's going to shift. So each one of you, consider yourselves, each one of you, as a research subject, even though you may not formally be on a trial.
Can I just add to that? I was not aware of this resource. I went to Dr. Bedard's talk at the Clinical Science Symposium. The title of his talk was Clinical Utility of Multi-Gene Testing in Metastatic Breast Cancer. And I apologize, I didn't write it down. It's in my other notebook. But he is running a registry where you can volunteer online and sign a consent. You will then be asked to submit germline DNA through saliva. You will be asked to submit blood because they're very... Yeah, right. Thank you. And I think that that's a very discreet way you can contribute. I do think, we all have to be a little cautious about this because some of the criticism was, well, this complex genomic testing thus far has not given us information like our colleagues in lung or melanoma might have learned. We have not found specific targetable driver mutations in advanced metastatic breast cancer. But at the same time, the point that he was making, which was right spot on, was that we don't capture a lot of data. And maybe if you would volunteer rather than us having to think about a clinical trial, that would be a way to get there faster. So thanks for pointing that out. I was not aware of that effort, and I think it's a great idea because it combines a little bit what Dr. Tripathi was saying about direct sort of citizen science, if you will, or consumer science to be able to contribute to the efforts.